Hey everyone, welcome to Facebook Live today. We have a very special guest, Dr. Andrea Logan. She's a pediatrician here with us in the system. But we wanted to talk a little bit about our contact tracing efforts. We're working on some articles and journals that we're hoping to submit with the help of Dr. Bobber, who you guys met yesterday, and Dr. Kenna and a few others on our team, and talk about the 4th of July today. So Lee, just tell us about where we're at. I know it's been a busy week for us.
Sure. So we continue to see a lot of outpatient positives. The good thing, it's young people getting it mostly that don't require hospitalization. But one point I wanted to make is, I guess if a kid gets it, they're going to be okay probably.
Right.
But
just not a huge morbidity in the pediatric realm, for which we are grateful.
Right, but one concern is them spreading it to their grandma or someone who is got it. So that's sort of a concern with children spreading it, right? But you haven't seen any instances where a young person has done really bad with COVID?
No, we've had 0 hospitalizations both here and USA in the pediatric. That's all pediatrics 18 and under. So we're doing real well,
That's awesome.
and that's going to be that way. And thankfully, children don't seem to be super spreaders. So it's not that you can't get it from children, but they haven't shown to be like really major vectors for transmission of the disease, which is very good news. We need some good news.
Well, that is very good news. So we'll shift a little bit here to, I want to come back to you at the end, but wanted to share today with you that we have done this paper, as Sarah mentioned. A lot of people contributed to it. A shout out to James Noblin for helping put it together, and Stephanie Holder, one of our tracers, and also Darylyn and Sonia in our infection and quality teams. But basically what they did, and this will be on our website, so
Yes.
How can they find this, Sarah?
So after we're done this live video, I will post the link in the comments of this segment, and then also we'll do a Facebook post as well to the link to the website.
So you can find this. It's a cool paper. So basically it goes through the evolution of what we did, and it talks about things we always talk about: wash your hands, don't touch your face, and physical
It's the
distancing.
singing of her story.
Yep, it's the scene of her story of how we did this, and it's about community education. People like Dr. Logan going out. Aren't you going out to the schools also, to one of the schools on a little task force there?
Yeah, I'm participating in the medical advisory committee to the Ocean Springs School District, so we're going to help the school districts out a little bit.
Well, that's great. So community education is a big
Right.
part of this. Melissa and her team also helping there. But a few things we did early on, we started a daily call every day, and whether it was pediatrics or hospitalists or whatever, we had people from all disciplines participating. It led to us setting up a hotline. We did 60 different initiatives to try to address it. One time they were taking over 400 calls a day. We had a large group of folks involved. We decided early on, before we really knew what we know now about it, to cohort everybody at one spot. Now we can sort of treat anybody anywhere, but initially we wanted to put everybody in one spot, and we did that with the negative pressure rooms. We had it talks about our PPE efforts, and ultimately what the system did to get out there and educate people in the public. And then we had a little social media section. We've used social media quite a bit.
Yeah, so one of the silver linings of all of
Website.
this is all of you guys watching our segments every day and keeping up with the latest updates regarding our fight against COVID. And the Stop the Spread campaign was a huge success, as well as the Singing River Strong, Singing River Heroes. We did the Facts Not Fears. That was really interesting. So we've kind of built out a lot of different resources that we never had before, and now we have them to share with you.
Another silver lining is telehealth. People were able to get in touch with clinics via phone, and that's something that different insurance companies didn't pay for or facilitate or allow before, and they did.
Right.
We did over
No tape
10,000 visits, but ultimately the paper gets into contact tracing efforts quite a bit, and the state health department was super overwhelmed, and so we had 15 people volunteer to be really, it started as navigators to help people on their journey through this, and they became sort of like little epidemiologists in a way, and ultimately through the contact tracing, this paper shows some of the things that we learned. And they would call people to help them figure out who to call, which doctor to call, what to do, whether they had children in the home that they needed to deal with or older folks in the home. Things like, people didn't know early on, quarantine for 14 days. And so they did a lot of that, but what we found in the contact tracing were a lot of clusters, and I'll give you, I won't go through all of these, but I'll share one or two examples. We had a situation where you had a patient early on in March that wasn't feeling well. We'll call it patient B11. They went over to C21's house to do some housework, and ultimately C21's son and another household contact got it, and unfortunately C21 had a lot of comorbidities. They had a high BMI, they had diabetes, they had some other immunosuppression issues, and that person passed away. And it's a real life example. When people say this isn't real, they clearly got COVID and they clearly passed away specifically from that. Another one of those patients also interestingly had a relapse of symptoms and remained positive. A favorable example, we had a healthcare professional who got it, realized they had it early on, got tested, isolated for 14 days, did not infect another person in their household, and was able to come back to work in 14 days. That's rare.
That's great.
Very rare. But there's a lot of other examples. I'll give you another one. A person in the workplace noticed a coworker coughed on them. And the coworker had been to one of the hotspot endemic areas where there were a lot of people. And sure enough, she started developing symptoms, lost her sense of taste a little bit, had a light cough, thought it was sinuses. She happened to have asthma. Unfortunately, this patient ended up having to be hospitalized for 2 weeks. And all from someone, we talk about all the time, don't let people cough on you. Avoid your distance to keep them from doing that. But anyway, I'll give you one more example. We had one situation where a sibling was taking care of some other members of their family, and ultimately in one family we had 9 people that got infected, and 2 of the 5, the ones that had the most comorbidities, passed away. But it goes through examples of, again, it's blinded, so you can't tell who it is, but it leads up to an example most recently of one that's included here on Memorial Day. There was a family gathering. This family gathering had a lot of people at it, and through one of those people then going to church and other family members, touching each other, hugging, kissing, doing things like that, they ended up infecting 7 family members. So we're a little worried with the 4th of July coming up. As a physician, any concerns or advice you'd give to somebody for the 4th of July to be careful out there?
I think the same things we've been saying all along. Please don't cough on your friends. If you think you have a little scratchy throat and you're like, I'm probably fine. No, not this year. You're not.
Right.
Maybe,
don't risk it.
Maybe we'll go back to normal some other time. But this year we're not going around to our friends, especially our elderly and sickly people. But
right.
The problem with the elderly is they don't want to know that they're elderly. Like my parents are 62 and they don't believe that they're elderly.
Right.
So keep your scratchy throat away from your friends.
For the benefit of other people, and as we said yesterday, there's never been a time in our era where putting other people first is more important. So don't cough on people if you think you have symptoms, especially this weekend. We are worried about, with the 4th of July, people getting together, family gatherings. And remember, our contact tracing shows that the person you're most likely to get it from is a friend or family member,
right.
Not a stranger. We have very few where they got it from a stranger.
Right.
Well, what's
Contact.
bad is it's supposed to rain all weekend, so everyone who was going to have outdoor activities, which are a much lower risk
Right.
of transmitting infection, now will be moving indoors, and so that could potentially cause some trouble.
So please be careful. This is happening all over the world. Maybe in our community we can do some things to make it different. Do the things the doctor says to do, and I think that'll help a lot. But kind of to wrap this up, ultimately this paper showed that we were able, with community education, to slow the spread of the virus. In fact, the city of Moss Point was known to be a hotspot initially, just because of a high concentration of population. And ultimately, right now, they are doing better than any city in not spreading because we spent the most time with community education.
Really?
So we're trying to figure out some ways to push more education out to other cities. One thing you can do, share and like our Facebook page. It's got everything you need to know. Sarah's done a great job of laying it all out there. But share that information with people. Spend a little less time talking about watching CNN and watching the facts, not the
Right.
fears that we have there.
More than 10 dedicated COVID pages on our website, SingingRiverHealthSystem.com. You click the coronavirus tab at the top, the big pink bar, and there is page after page after page of information that you can easily share the links with your friends and family. And just, if you're interested, it is pretty interesting stuff. Like this article, you never would have thought that this kind of stuff could happen down in South Mississippi, but we took care of it.
Here we are. Well, listen to the experts. Honestly, that's the best thing you can do. And we hope that you stay safe this weekend. And please share this with your friends and ask them to do the things that she and the other doctors have told you to do. Don't hurt your friends and family member. And so if you do those things, you can help us, and you can stay Singing River strong. So happy 4th of July. Give us one of these. This is our new salute. There you go. Singing River strong.
Bye, everyone.